Oh, Canada, we stand on guard for thee. Oh, Canada, we stand on guard for thee. The King. So this week is a very special week, not just to Rotary, but to all volunteer organizations across the country and the world. But I'm going to have our Sergeant at Arms start us off because he has a great discussion point on that. Al, take it away, sir.
Good morning, President Tim. Good morning, fellow Rotarians, and a special good morning to special person in our community, Chief Dyke. Good morning, Chief. So who we got on Zoom? We've got Katie. Good morning, Katie. Paul, good morning. Lesley, our guest speaker. Lesley, we're going to get to you in a few moments. You're going to be properly introduced, but thank you for joining us. A warm welcome from us at Rotary. And Chantel, good morning, everyone. Okay, as Tim just mentioned, this week is special. In the States, the month of April in the States is Volunteer Appreciation Month. Here in Canada, we have Volunteer Appreciation Week, and it goes from the 16th of April to the 22nd. So, what is a volunteer? What is a volunteer? So, the people in this room, and you're all volunteers, you probably never asked yourself that question, but let's just explore it a little bit. What is a volunteer? A person who freely offers to take part in an enterprise or undertake a task. He or she volunteered for the job. What is the most common type of volunteering? Fundraising. Fundraising. And I guess maybe the hardest part is the fundraising, but that's a huge part of every organization is fundraising. And a huge part of the team that does it are volunteers. What are the benefits of volunteering? Volunteering can provide a healthy boost to your self-confidence, self-esteem, and life satisfaction. You are doing good for others and the community, which provides a natural sense of accomplishment. Your role as a volunteer can also give you a sense of pride and identity. I guess we never think of these things when we go out, we do all the things we do, we just do it. There's people in this room, and I have the very good fortune to know them and to work with them for many years now, who are wonderful volunteers in this community. And it's not just about Rotary. It's about all the things they do. And you know, you hear me say it all year long, and I thank the people here who go out to the community and do other things. And as we look around the room, we see who they are, we hear what they do, and we hear about the success they have. The theme for Volunteering Appreciation Week this year in Canada, the theme for it is Volunteering Weaves Us Together. And you know, I've always said that I would much rather have all the people in the room do a little than just a couple do a lot. If everybody does a little, we're so successful. We're so successful. You know, the story is that 5% of the population donate 95% of the money for fundraising. Small group of people, a small group of people. But you know what? If we all work together, don't let it scare you. And I don't have to preach this to you people, but it's a wonderful. I got a great deal of satisfaction of just going out there and just doing stuff, because you see how it benefits organizations. You see what happens. So to all of you, a tip of the hat. You're a wonderful bunch, and on Zoom, we don't want to miss you out on Zoom, but volunteering is just something that we started volunteering, Sue and I, when the kids were very, very young. Nursery school. Sue was president of the nursery school, and president of the parent-teacher group at Goodfellow. Collected money for a new track, raised funds for gowns for the choir. There was always something on the go. And then the kids went to high school, and that was a little bit different, But then they got involved in sports. And of course, the sports needed money. They needed money for sweaters. They needed money for accommodation when they traveled. And that was part of it. And then other things came along. And of course, Rotary came along 13 years ago now, 13, 14 years ago. And that was, I found that Rotary, of all the things I did when I got involved in Rotary, wow, that was an opportunity to really excel, to really get out in the community. And you see when you go places, you'll be introduced to someone and they'll say, oh, I know you, you're in the Rotary Club. You're in the Rotary Club. So what we do is well recognized, but this weekend, on Saturday, volunteer appreciation afternoon tea at the town hall. And you're all invited, all Rotary's invited. And it's a great event. I remember going to one a few years ago, and it was at the YMCA, and there must have been 200 people in the room. And Anne was the recipient of the Volunteer of the Year in Innisfil. And very well deserved. I think she should get it every year. No, but so again, volunteering, that's what it's all about. I just think of the South Simcoe Police Service and all the auxiliaries. And is it fair to say, Chief, that you'd have trouble with some of the events if you didn't have all those auxiliaries?
Totally fair. There's some we wouldn't be able to do, like large Santa Claus parades and stuff like that.
We see them at the parade, every intersection.
It wouldn't happen without them.
And they're auxiliaries.
Yep. And
we know a lot of them. So every organization has people who volunteer and work behind the scenes. Now, I make sure I've covered everything. Yeah, okay, I'm closing. In Canada, each year, 24 million people volunteer. 24 million people. Can you imagine if all of a sudden 24 million people stopped volunteering? It's almost like the country would ground to a halt. So to all of you, thank you, and please turn to the person beside you and thank them for what they do. Thank you. Jim, thank you.
Thank you, Al.
Okay, bud. Okay, that's it this morning.
I'll just add a couple extra points that Al, that was fantastic. Fantastic summation. Just one the other thing that people don't think about in volunteering is from the youth perspective. So we have a lot of youth who are aimless. They really don't know what to do. Maybe they're leaving they're leaving high school, going into or college or university age, and don't know what they want to do yet. Oh, go take just a general year or something like that. Maybe that's not the way they have to go. Maybe what they should do is take a proper gap year, go and volunteer. Get into organizations that give you some guidance, because I was somebody who, I went to the college, didn't do extremely well, wasn't great for me at the time. I did volunteering right away, and I've been involved with so many different associations, and I was saying to my kids, most of what I have through volunteering. Either directly or indirectly. It's either the contact I met or a particular association that, because I was affiliated with and I went for a job interview, that person went, I love that association, you're in. I mean, these things actually happen. So telling youth that volunteering can also be deeply part of your brain selfish. It's you're actually getting something from it. And that is the most rewarding thing we can teach our kids. That they can give to the world and still be getting in return. That way everybody wins. So, as I was saying to Anne earlier, unfortunately I left my agenda on my printer at home. So what is our next speaker? Okay, fantastic. So Anne, are you
I will introduce our speaker, yes.
Thank you. I will get out of the camera.
Our speaker today is Lesley McMullin, and Lesley is joining us by Zoom today. Lesley has got her BA, Bachelor of Science in Human Nutrition and Master of Science in Food and Nutrition. She worked at the Simcoe Muskoka District Health Unit in the Chronic Disease Prevention Program since 2014. She lives in Aurelia with husband and 2 children. She's involved in nutrition, food basket survey, and household food insecurity work at SMDHU. She's the co-chair of the Ontario Dietitians in Public Health Food Insecurity Work Group. So welcome, Lesley. Thank you.
Thank you very much for the introduction, and also happy Volunteer Week to all of you. I have a slide deck here, so I'm going to share it through, and I'm hoping it appears on your big screen, okay? How's that?
Yep, we hear it.
Perfect.
Well, your volume just dropped for some reason.
Okay.
There you go. There you go. You're better now.
Okay, I think as long as I speak loudly, I feel that you're hearing me okay. So please just jump in and give me a reminder if you can't hear me. So pleased to be here today to bring this topic to your group. I can't see you when I'm in presentation mode, but I'd love to answer your questions. So don't be shy about jumping in and letting me know if you have a question, or if you cannot hear me properly, please just let me know. I do not mind at all about being interrupted. And my colleague Chantel is here on the line as well, Chantel Mayer. She also represents this topic in the community. There she is. Hi, Chantel. And she works specifically in South Simcoe for the Simcoe Muskoka District Health Unit in our chronic disease prevention team. So she's in your region. So we wanted to bring her along today to Innisfil Rotary. So thanks for having both of us. This presentation about monitoring food affordability, it's been requested quite a bit, especially since the pandemic in community groups. So we're pleased to be here to talk a little bit about it today. It's grown a little bit as groups have asked other specific questions. So we attempted to not make it really statistics dense, but there are quite a few numbers in it. I will send along the slide deck to you by email so that anything that you're interested in or wanted to follow up on or might be helpful in your community work, you'll have those links to the websites and to the references as well. And you can always ask questions to me before or sorry, after the presentation or today. Okay. So quick overview of what I'm going to talk about today. Really just how and why we do this monitoring food affordability work. We use the nutritious food basket tool, and also information about household food insecurity. And I'll define that in our region as well as in Ontario and Canada. That's the real reason we do this work. And I'd like to share some evidence-based solutions to challenge the problem of food insecurity with everyone, and share what our health unit work has been on this issue to date and sort of where we're going in the future with that. A little bit of history about why we got into this work. Our public health standards, which all of the health units work rest on, actually mandated this starting in 1998. These are photographs of our standard documents, nothing too exciting there, but it has changed it and shift over the years. And now, since 2018, we're doing this work under the banner of the Population Health Assessment Surveillance Protocol, and with assistance from the Monitoring Food Affordability ref all across the province in all of the public health units to determine the food affordability rates. We use the tool called the Nutritious Food Basket, and it has been designed specifically for this purpose. And it's also used in the other provinces, but looks a little different. It's had some changes over the past few years because of the change with our Canada's Food Guide. So this slide just attempts to describe sort of the timeline of how those changes occurred. It has changed how we report on the nutritious food basket. And in about 2019, this change kicked off with the release of our new Canadian Food Guide. But what we do essentially here is monitor food affordability using this nutritious food basket survey. Our grocery stores are surveyed in our region all around Simcoe and Muskoka. And to provide just a brief background about the update that happened, Canada essentially revised the list of foods that needed to be costed to reflect purchasing patterns today, as well as our new food guide. In truth, there were lots of foods on the food list previous that we wouldn't really consider the basis of a really healthy diet, just because of the changes and trends in what we consider to be healthy. So after the Canadian government had their new food list, Ontario set forth on revising our tool. And this work was done largely during the pandemic by some staff that weren't redeployed to pandemic efforts. And by last year, we were able to use the costing tool. So we went out in May and June, like we have always done prior to 2019, and did our food costing. And this time we did it in a hybrid model. So meaning we costed in the grocery stores as we have done forever, but we also costed stores online. And this, was really useful and saved a lot of time and risk being out with virus transmission. But we're sticking with that model because online grocery shopping is just so prevalent now, and the validity of it was tested and it works. So that's what we'll be doing. But because we have this new process, we're not able to compare our data from previous. So the last time we had done our NFB, our nutritious food basket survey, was prior to the pandemic, and the data that we have now can't compare to previous because the survey tool is different. So with respect to why it was updated, the foods reflected in our Canada's food guide have shifted. We see more plant-based foods, we see a little less meat, we see certainly more whole grains, a call for most of our grains to be from a whole grain option, and less sugar and salt. Okay, so really, to monitor food affordability, what we need to do, we need the food costs, but first we also need income data. So what we do is, just to kind of let you in on kind of how this process comes to be, we look at incomes and we use a specific time frame of May and June and consider the highest possible entitlements for Ontario residents who are receiving different types of income, social assistance, seniors pensions, sometimes low income work like minimum wage work. So this will be summarized later in the presentation, but we get that income data, including any tax benefits and credits, and then need to consider food data. So that's when our surveyors get out into the grocery stores, calculate the cost of 1 week's worth of groceries in our region by costing 61 food items in every store, and then compiling these to get average prices with some pretty strict methodology around how the costing is done. And then thirdly, we need rental data. And we get this from the Canadian Mortgage and Housing Rental Report. And average rates are calculated in different parts of our region, Simcoe and Muskoka, for bachelor 1 and 2 bedroom rental units. And then with those three pieces together, we can create income scenarios that reflect food affordability. So maybe I'll just stop there and ask, is there any questions in the room?
Not yet, Lesley.
Okay, thank you. So once we combine these aspects, we can form income scenarios that represent people living on low incomes in our region. This graph represents the cost of healthy food and housing for both Simcoe and Muskoka combined. And these scenarios really are the reason that we do this nutritious food basket costing. And there's no easy or simple way to display all of this information together because it's lots. But over the years, this blue bar chart has always been the most appreciated by groups to kind of digest and compare the information in one spot. So the red vertical line shows where 100% of folks' maximal income will be. And then the blue bar is the percent of total income required to afford the cost of healthy eating and rent. So we see in some cases that there just isn't enough money and that they would require more money to actually purchase both of these items. So It's been unfortunate year after year, these survey results have demonstrated that Simcoe Muskoka residents living on low incomes just do not have enough money for nutritious food and basic needs. So this is a key public health problem with respect to how much influence healthy eating and eating in general has on reducing the risk of chronic diseases. So for people whose incomes are social assistance or minimum wage work, the cost of healthy food and rent usually uses up most of their income. And we know that oftentimes folks have to make compromises on one or the other to make ends meet and to just keep on keeping on. The top bar represents one person living on Ontario work. So year after year, this has always been a vulnerable situation. This individual, based on these data pieces, would need over $500 just to kind of make ends meet. So that the bar represents 160%. The next scenario is a one-person household on ODSP, or on Ontario Disability Support Program. So a little bit less vulnerable, but still very risky in terms of being able to afford the costs of food and rent. Then as we go down the bar chart, we've got a family of 4 on Ontario work. So reflecting the fact that folks with children do get extra benefits. So they're using 95% of their income. A single parent household with 2 children, Ontario Works, has a little bit extra support. And then we move into a married couple receiving Ontario Disability Support Program, a one-person household receiving old age security and guaranteed income supplement. We'd like to call out this scenario because over time, it has been recognized that our OAS and OAS and GIS programs for seniors in Ontario and in Canada has really been supportive in preventing household food insecurity, which we'll talk about soon. And just the reason being is it's indexed to inflation. So as prices rise, so do these incomes. We see our minimum wage earner, family of 4 minimum wage earner, second end, requiring a great deal of their income, 66%, but certainly much better than some of the top blue bars. And then our family of 4 median income earner, 28% of their income required for food and rent, lots of extra income available for the other basic necessities, plus just the fun parts of life. So there's a lot more detail about this on our website, and I've included links to that in our presentation. Some groups are very specific about what information they're looking for and kind of what family types around this issue. So is healthy food affordable in Simcoe Muskoka? No, I think clearly not for everyone. People living with low incomes are experiencing what's known as household food insecurity. And just to define that, that's the inadequate or insecure access to food due specifically to financial constraint. So to put it plainly, sometimes we say in our work, it's not having any money for food. And our previous campaign around this work was called "No Money for Food is Senseless." The financial assets that are constrained can include just not having enough income, but also a lack of assets or savings, a lack of access to credit, too much debt, or housing costs that are just too high. Household food insecurity can range. It can be marginal or kind of occasional, and range all the way up to severe. What this can look like for folks living in our region who are experiencing household food insecurity is worry about running out of food. You know, how am I going to do this paycheck to paycheck? Cupboards are getting empty. And it can range all the way up to, going without, so their children can have their meal. Missing meals altogether. It can go, as severe as missing a whole day or several days worth of food. So this just is no way to live and has a huge impact on health. We do know that food is one of the first expenses to be sacrificed. Generally, people will choose to save money on food so that they can pay for the other basic needs that they must have, such as medications or their phone, just to stay tethered to family members and friends. Transportation, there's childcare that's necessary in some cases, our utilities, and then there are other pieces too that are, we really wish that folks could have money for, like savings or an emergency fund to weather storms that could be ahead, and to plan for the future. A key local statistic for our area is that in Simcoe and Muskoka, 1 in 6 households experience food insecurity. And this represents 37,000 households, or over 85,000 individuals, or 16%. So this number is high. It's remained high. It became higher throughout the pandemic and then sort of came back down a little bit after those times, but it's still too high. We see the highest rates in single parent families and people who are renting or attempting to rent their own home. So with the highest vulnerability. Also like to comment in the statistics folks at the health unit ask me to comment that this is an underestimate as well, because it actually does not take into account people in First Nations reserves, as they weren't included in the survey. And we know that there's a very high rate of vulnerability in Indigenous reserve in our regions. So it could be higher. It is likely higher. We look at a snapshot of Ontario, just zooming out a little bit, we see the same rate in Ontario, 16% for household food insecurity. And also that 1 in 5 children are living in a food insecure house, which actually amounts to many, many children in the province, about 500,000. We know that 67% of households receiving social assistance have some food insecurity, and that's no surprise given our scenario about the unaffordability of that situation. Also, 48% of households who are working report some food insecurity as well. So this is contrary to the belief that having a job protects families from food insecurity. We know that for many workers, it's just not enough to make ends meet, depending on the quality of their work or their wages and benefits. We zoom out a little bit more. If we look at Canada in 2021, 5.8 million people, including 1.4 million kids in the 10 provinces, lived with food insecurity. These numbers didn't include folks in the territories or on First Nations reserves, who again are recognized as having high food insecurity risk. You can see on this chart that in Quebec, they're doing a little better with 13%. And out in Alberta, the rates are as high as 20%. We're sitting in the middle around 16%. And in the research around this issue, the reason for the shifts in different provinces is often touted by the increased benefits in Quebec that we hear here, certainly around families, and then maybe the reverse in Alberta. This isn't a new problem in Canada. We've had really high rates for a long time. We do use this monitoring food affordability data to help with advocacy, and that's largely what the health unit's been involved in, to help increase awareness for improved incomes for people who are vulnerable. The reason we do that really comes down to the health impacts of food insecurity. And we've got some very clear data about this coming out of the University of Toronto organization called Proof. Their main focus is exploring the health impacts and other social problems related to household food insecurity, and really recognizing how this is a problem of income. So what does this do to health? these are tough pieces, I find, because it's just a sad situation. But with infants and children, we see high rates of poor nutrition and poor growth, and proper development, higher rates of asthma, and poor mental health and school performance. In young people, we see higher rates of anxiety and mood disorders, and also suicide. In adults, we have certainly much higher rates of chronic diseases like diabetes, hypertension, high blood pressure, heart disease, poor oral health, and even increases in the risk of early death. With our healthcare costs, we find food insecurity being linked as a very, very costly problem for our healthcare system. See much higher rates of hospitalization and longer stays in the hospital system, and many more readmissions. So that kind of a frequent flyer situation. It also contributes to higher individual healthcare costs. There was really, really compelling data about this that linked Ontario OHIP card numbers and the household food insecurity data together to show that the costs for folks with food insecurity are 121% higher. So it was 2015 data. So the numbers are likely higher, but it was like, $1,600 a year for the food insecure individual and $4,000 a year for someone with food insecurity. So it's just a really expensive issue too. We understand that food insecurity is a problem of inadequate income that can't be solved by providing charitable food alone. However, in Canada and in our region, we have a very long history of food charity, which has created just a massive network of nonprofit food providers like food banks and soup kitchens and pantries, and now community fridges. But there, unfortunately, over this time, just has not been a reduction in food insecurity rates. Government responses even have focused on charity, with a lot of funding going towards charitable food initiatives during the pandemic. So the issue with that is that the impact on food insecurity is very temporary, and also isn't able to reach many folks who are experiencing the problem due to a variety of reasons that are listed on the slide here, around distance or transportation, and even issues around stigma and dignity. Some people's personal beliefs and cultural systems, they're just not able to use food charity. So we try to raise awareness around this too, because we really need to repackage the message about household food insecurity, and that it is a problem of income and not a problem that can be solved by providing food. Many of the charitable food organizations in our region have come on board with working hard on top of all their other exhaustive efforts to help with advocacy to the provincial and federal government to say that vulnerable folks just need better incomes, wages need to be higher so that they can put themselves out of business. To tackle food insecurity, what we do see that is working based on evidence is solutions that target the cause, which is insufficient income, so not enough money for food. Income is a sole determinant of health that we know directly affects household food insecurity. We need income-based public policy that provides people with enough money to meet their basic needs. And we've had lots of research and pilots that have shown that policies that improve the financial situation of low-income households really greatly reduce the risk of food insecurity. So one of the first things that goes back into the budget is food and better food. Social assistance is really a key area for advocacy currently, because there have been some small improvements in other pieces of social assistance. They're marginal, but little increases. So currently, social assistance is in need of a big improvement, as folks that are are living on those incomes, either temporarily or for a little longer, are really, their health is declining very fast. There's evidence that show there's evidence from the Maritimes that increasing social assistance rates had a great created a great reduction in food security rates, and then therefore improvements in health. Another idea that really had some time in the sun a few years back is basic income. Here in Ontario, we had a pilot going. Shortly after was canceled by the Doug Ford government. But this is an idea that is popping up kind of all over the globe. And there is a pilot currently in Prince Edward Island. And the idea here is that everyone would have a basic floor of income. So anyone who falls below that income floor with the other income that they're receiving from wages or some type of social assistance or a pension, they would receive a cash transfer that would boost them back up to that basic income floor. So that's something I think we'll just continue to hear more and more about. And I've heard some people say it's not if we'll have a basic income someday, it's when. So hopefully there's increasing understanding about how that works, and because it is complex. A third strategy is wages. So eliminating the gap between the minimum wage and the true costs of living. And we have just recently heard about an increase to living wage that's happening on October 1st of this year. And then we've got rates for our region, specifically from the Living Wage Canada group, which are really interesting. So they've got a great website that shows like what the costs of living are around the province of Ontario. That's cool to check out. So these strategies cost a lot for sure, and I'll bet that's on your mind, but it is important to think about the savings we can achieve in the long term down the road when efforts to reduce poverty are taken. So what is our team back at the health unit doing with this information? The Chronic Disease Prevention Program. We're continuing to monitor food affordability. In fact, we're rolling out the door to do our grocery costing in just under a month. Chantal and I are actually paired for one of our stores, so we're looking forward to costing that store together. And it'll be 14 stores in our region that we cost again this year. We're continuing to raise awareness about food insecurity and food unaffordability and how this links to poverty. Our previous work on household food insecurity really was around raising awareness and attempting to generate advocacy around income. We're currently working on revising income policy options that relate to municipalities, so more work at our local level, and just kind of getting the last board approvals on that work to determine like what the key priorities will be to work with municipalities, and excited to do that work. And a lot of times that work does involve community partner groups to help with generating interest and understanding for municipalities to feel supported to move forward with those changes. One of the ways this year that we have sought to raise awareness about food affordability is with a social media campaign. So this rolled out in February, March of this year, and it was called The Real Cost of Unaffordable Food. And these are some example posts that were part of the social media kit. A number of our community partners picked this up. So these are examples from their social media accounts, Facebook, Twitter, and Instagram. And we also had as we do every year, we had a media release that was picked up really widely. So you may have read that in your local newspapers about the food basket data and the monitoring food affordability scenarios. That was really, really heavily picked up. So we hope that helped to spread the word. This is a slide that one of our health promoters pulled together with various comments by way of the social media campaign. And we thought they were great. We learned a lot just hearing what the public had to say about the campaign and kind of how they connected it to their personal life and their experiences. And we can tell from this that, you know, certainly food affordability is on the mind of many people. That was very clear with the media through the fall and definitely through the winter. This is a snapshot of lots of the headlines that were making way around inflation and food costs. And certainly now we've heard about the GST grocery rebate. And we know that food affordability is something that is affecting everyone now, not just folks living in our community that are the most vulnerable with low incomes. So, this is a bummer for everyone now, but we are thinking that the public might be better positioned to understand the issue and how it could be affecting vulnerable people in society and realize.
Lesley, that's probably a really good area for us to probably wrap up this particular conversation. Unfortunately, we're very tight on time.
Okay, goodness.
Do we have time for one or two questions really quickly? Anybody have anything significant to bring up? Well, we will certainly all endeavor to check out the campaign to see how we can individually. But otherwise, I wanted to thank you so much for your presentation today. On your behalf, the Rotary Club of Innisfil will be donating to our Polio Plus program, and past President Ann Smith will be reaching out to you with that information. So thank you so much for this. You're welcome to stay for the rest of the meeting if you want, but if you have other things you need to jump onto, that would be that'd be fine too. It's up to you.
Okay, thank you. Yeah, no, I'll be on my way. And if you have questions that come through, please let us know. We'd love to see what the group thought of the information and what your reflections are.
Fantastic. We did record this, so we will certainly be able to share that more broadly.
Okay. Thank you.
Thank you. All right, Al.
Okay, so the most important part of any Rotary meeting, and the most exciting part of any Rotary meeting, is the induction of a new member. And this morning, we're going to do just that. So this is wonderful. So Debbie, so the membership committee, please come up. And Ann from the membership committee, come up. Barb, the sponsor, please come up and bring on your stuff. And
all of my stuff.
Chief John Van Dyke, come on up. What we'll do, we're going to induct John, and then at the end of the meeting, we'll very quickly move these tables up and we'll get a photo of John and the car, okay? So don't leave, okay? So come on in, John. Fellow Rotarians, it is my privilege and pleasure today to welcome into the membership of our club, John Van Dyke, whose name was proposed by Bart Bagley. The proposal has been reviewed in accordance with the Constitution and bylaws of the club. John, we now proceed to admit you into the membership of the Rotary Club of Innisfil, and so to the Fellowship of Rotary throughout the world. It has already been explained to you that the ideal of Rotary is service. Our principal motto is service above self, and the object of the club and all Rotary clubs is to encourage and foster this ideal as a basis of worthy enterprise. You are to share in this effort. You have been approved for membership in this club because we believe you to be a worthy representative of your vocation, interested in the ideals of Rotary, and willing to do your share in translating these ideas into tangible realities. You have agreed to accept the obligations attached to your membership in this club and to obey this club's constitution and bylaws. Now I have the pleasure of asking your proposer, Barb, to pin on the Rotary emblem, which we expect you to wear with pride. And Barb's going to need a ladder to get up there. No.
Well, I could do that because I know you have this one. You're not going to get it.
And we've also got your membership back. Wow. And thank you. Well. And at great expense from the club, our yellow t-shirt. Oh.
It's your work shirt.
It's your work shirt.
I'm Yeah, we're good.
Will it fit?
This next hour.
All right, so John, over, you're gonna face out. Ladies come in and just a couple of quick photographs. Okay. John Van Dyke, welcome to the Rotary Club of Innisfil. Fellow Rotarians, I'm happy to present to you Rotarian John, our newest member. Just a couple of quick words.
So, you know, like, you're inducting me, but this is actually all about the South Simcoe Police Service.
That's right. That's
Um,
right.
You know, and I will do my best to be here as much as possible. It's not the Senate representative. Happy to be here, happy to engage with fellow Rotarians, and, you know, we're all about, the South Simcoe Police is all about engaging with our community, being part of our community, and building up our community. And I think Rotary is a great place for us to accomplish one of those goals. So happy to be part of the club again.
John,
on a return engagement.
John, it is an absolute pleasure to have you in our club. Thank you so much.
All right,
President Timmy,
Yes.
just follow up with an email to the club about that.
yes,
Yeah.
I'll talk to Jeff. We're gonna connect later today anyway, so yeah, we'll make sure of that. And okay, I do have the Onion Fest volunteer sign up forms here, if I can pass them, but again, we only have about 5 minutes. Because Barb needs to have a quick chat, so I can start handing this out. If anybody wants to put their name down as that they actually want to be involved with Indian Fest, we'll just pass it around. And Barb, you can have the floor.
Thank you, President Tim. I have done inventory of our remainder of yellow worksheets or shirts, not sheets, shirts. And we will be ordering more of those. If you have a specialty size you feel you need that might not be in our normal inventory, this is the time to get that order in, because when they are one-offs, they're too expensive. I did want to let you know I sent out, and Janet lit fire under me and got me started. These are shirts that are the kind that we have that have our Rotary logo on them and so on. And those are at your own expense, so we'll be going through an order process. And they also can come in performance fabric too. So if that's what you prefer, then you have to just come down.
Do they have our Innisfil on it, or is it just?
This one is a train crew one, which only they can have.
So the ones you're ordering, are they going to have international or
No,
Innisfil?
no, they'll have ours on like that
Yeah, they'll have
They'll
Innisfil.
say Innisfil,
Like
like
that.
not Rotary.
one, just like that one.
Okay.
Yeah, it's like the embroidered one. I
And
have.
the other ones are purchased at conferences, so they don't have the Innisfil on it. So I'm gonna try to do it, and Janet, thank you so much for the offer to help, and we're gonna get it done. And we need to have a short turnaround on it, because I find when things lay on people's desks, they don't get done.
Exactly.
So I've sent you out an email already. I do have a couple that are in my own inventory that I shrank out of. And if anybody is interested, there's this navy one and this lighter blue one. And you can just pay something, we'll put it into the Rotary charity fund. So that's it. And I will talk to the providers to get some pricing, but they're all basically gonna be the same, actually. So that's it, and I'll follow up
Thank you, Barb.
with Janet. If it comes from Janet or I, it's real, it's not spam.
On the note of Janet, do you have anything for Learning Corner?
Just very quickly, one of the things that's being pulled through, and we saw this at the district conference this past, or not district, but the Rotary weekend conference, was the new pins that are coming out for the diversity, the equity, and the inclusion. And it's a lovely little heart with the Rotary logo on it. They said if we wanted to get one for each of our members, we would have to know the numbers, and then I can let incoming district governor elect Juanita how many she wants or how to get, and we can order them.
Just
So
schmooze up to them, because they usually just give you a couple bags. That's what Richard did with us.
that's the whole club
Okay.
we're talking here. because she's not gonna order them for the whole district all at
Right.
once. So, some of us were able to get one because we were speakers.
Don't run with me yet.
At
For
the
the pins?
Rotary Weekend, but we can order.
Did you?
I didn't know, but there were,
They were special gifts. to
They were
people.
for this
Oh, okay.
purpose. I was a speaker,
Yeah.
a presenter, so I got one. So they're gonna be sending. So let me know if you want one of the pins. I'll leave it here for people to have a look at. And then, let me know and then I can take account. I'll send out a club runner. No, as far as I know, we don't, we just.
I think that.
I don't, Janet, be careful about that.
Yeah, I think we do.
Yeah, it might be, but I just don't know the cost. That's what I meant.
Oh, man.
They're usually around $5.
Okay, 50-50.
Look the other way, John, right now, look the other way.
Okay, last three numbers, 839, just before me.
What's that?
Oh, it's me.
Oh, it was you. That was 838. Oh. Okay, this has been absolutely wonderful. Just making sure there's nothing else on the agenda. Anything else for the Rotary that we need to?
Well, I just want to say I was at the RVH volunteer appreciation.
Folks, Teresa's talking. Please.
I was at the RVH volunteer appreciation luncheon yesterday, and I met up with Jason, and he wishes me extended a big hello to everybody. He misses you guys.
Same as Grace Dorn.
Oh, yeah, Grace was feeling,
She's doing well.
Yep. I should tell them that they're welcome to join us at a virtual meeting anytime, so that's great. Okay, otherwise, thank you everyone for a great meeting. Have yourself a wonderful week and get out there and sell books and contact Jeff or I.
We're gonna have a photo